What kind of idea is this? Distinct from Christian or Buddhist ideas of virtue or sin and salvation, the Panchatantra is about an art of alliances and antagonisms. Antagonisms can exist between disciplines and forms of thought based on narrative or numbers, or when one meets a patient, caregiver, and clinicians, even in a formal clinical setting, their perspectives may be sharply antagonistic with one another. In certain forms of distress, aspects of ourselves might be at war. As such, a health-seeking intervention or a form of joining between different ways of thought might be the art of creating the right alliance. At the same time, even in an alliance, one might want to keep space for antagonisms. How would we learn this art of watchful alliances and antagonisms? The Panchatantra is composed of 5 parts: on causing dissension among allies, on securing allies, on war and peace, on losing what you have gained, and on hasty actions. In the spirit of the Panchatantra, rather than thinking of psychiatry or the psi disciplines more broadly only as a form of power, instead, today I offer you a 5-part weave on how we might think about both alliances and antagonisms between anthropology and mental health research and practice.